Lithium toxicity, what is it? It's a high lithium serum that's in your blood. It has 3 grades: mild 1.5 to 2, moderate 2 to 3, and severe 3.0 and up. The mild signs and symptoms are nausea, vomiting, diarrhea, reduced coordination, drowsiness, slurred speech, and muscle weakness. The interventions for these are withhold drug, call provider, do a serum check, suspend or reduce the dosage. The moderate signs and symptoms are confusion, incontinence of bladder, vertigo, blurred vision, tinnitus, myocyclone twitches, and etc. The interventions are withhold dose, call provider, get a stat lithium serum test, and start an IV to maintain renal function. For the severe signs and symptoms are included cardiac arrhythmias, hypotension, peripheral vascular collapse, seizures, a coma, and muscle jerks. The intervention for this is to remove any lithium from the body, such as by using mental urea, hemodialysis, and also monitoring for circulatory, respiratory, thyroid, and the immune system. What causes lithium toxicity? It is caused by too much salt in the diet due to salty foods or processed foods, also caused by low intake of water or loss of fluid by sweating, vomiting, or diarrhea. It is common in compromised renal function patients, also urinary retention patients, and individuals taking low salt diets or diuretics. It can also be found in brain or cardiovascular damaged individuals. Clients should drink adequate water, such as 2 liters a day, in order to not get lithium toxicity. We should, as nurses, check their daily weights and intake and outputs, check for edema, and call the provider if diarrhea, fever, flu, or dehydration occurs. Older adults can have symptoms of toxicity at lower levels, and patients and families should be aware of signs and symptoms before discharged.
Magnesium imbalance. Magnesium is important for maintenance of the heart and the kidneys. The normal adult range is 1.5 to 2.5 milliequivalents per liter. Shifts of potassium into the cell causes hypomagnesemia. Involves a variety of metabolic activities in the body, such as relaxation of smooth muscles surrounding bronchial tubes in the lungs, skeletal muscle contraction, and excitation of neurons in the brain. Too much magnesium decreases the absorption, and too little magnesium stimulates absorption from the intestine. Calcium imbalance. Calcium is important for healthy bones and teeth. Calcium helps muscles contract and nerves transmit signals. The normal adult range is 4.5 to 5.5 milliequivalents per liter. Potassium imbalance. Potassium is important by helping muscles work, including the muscles controlling the heartbeat and breathing. Potassium is a mineral found in food sources. Potassium assists in essential body functions such as blood pressure, normal water balance, muscle contractions, nerve impulses, digestion, heart rhythm, and pH balance. Healthy kidneys maintain normal potassium levels by removing excess amounts through the urine. The normal adult range is 3.5 to 5.0 milliequivalents per liter. Sodium imbalances. Hyponatremia is a decrease in serum sodium concentration less than 136 caused by an excess of water relative to solute. Common causes include diuretic use, diarrhea, heart failure, liver disease, renal failure, and the syndrome of inappropriate ADH secretion. Symptoms are nausea, vomiting, headache, confusion, loss of energy, drowsiness, and fatigue, restless and irritability, muscle weakness, spasms or cramps, seizures, coma. Treatment. The primary treatments used in the management of hyponatremic patients rely on the use of an IV sodium-containing fluids and fluid restriction, less commonly loop diuretics or dimethycycline are used. Hypernatremia. What it is, causes. Serum sodium above 145. Although hypernatremia is most often due to water loss, it can also be caused by the intake of salt without water or the administration of hypertonic sodium solutions. Symptoms: thirst, headache, nausea and vomiting, lethargy, confusion, seizures, loss of consciousness, coma. Treatment: patients should be given IV 5% dextrose for acute hypernatremia or half normal saline. For chronic hypernatremia, if unable to tolerate oral water. Chloride imbalances. Hypochloremia. The normal serum range for chloride is 96 to 106. Chloride levels at or above 110 usually indicate kidney dysfunction, as it is regular of chloride concentration, caused by loss of body fluids from prolonged vomiting, diarrhea, sweating, or high fever, high levels of blood sodium, kidney failure or kidney disorders, diabetes insipidus or diabetic coma, and drugs such as androgens, corticosteroids, estrogens, and certain diuretics. Symptoms: fatigue, muscle weakness, excessive thirst, dry mucous membranes, high blood pressure. Treatment: if dehydrated, IV solutions. For kidney failure, referral to nephrologist. If caused by meds, stop taking the meds. For hyperchloremic metabolic acidosis, may be treated with a base called sodium bicarb. Hypochloremia, sodium level below 97, caused by loss of body fluids from prolonged vomiting, diarrhea, sweating, or high fevers, drugs such as bicarb, corticosteroids, diuretics, and laxatives. Symptoms: nausea, vomiting, headache, confusion, loss of energy, drowsiness and fatigue, restlessness and irritability, muscle weakness, spasm or cramps, seizures, coma. Treatment: caused by medication, stop the medication, electrolyte levels tested regularly for monitoring purposes, consuming more sodium chloride.